Hello, my name is Sarah Edwards and I'm a public health epidemiologist, and I'm currently in a role fully seconded to the Métis Nation of Ontario to support data, health research and analytic projects. I also, through this role, participate in a vaccine preventable disease working group on behalf of the Métis Nation of Ontario. And recently we've received an update on the avian flu, which I've been asked to share with all of you. So we're going to start with some background on avian influenza or avian flu. So avian influenza is a disease in birds caused by a virus that is primarily infecting wild birds such as ducks and geese, as well as domestic and commercial poultry. The currently circulating virus is known as the highly pathogenic avian influenza, or H5N1. And this is an influenza subtype that's known to kill both wild birds and commercial poultry. Although the overall risk for the general public is very low, there are particular groups which have an increased risk, including harvesters, which is why we're sharing this information today. So in terms of what's happening currently with the highly pathogenic avian influenza, multiple outbreaks have occurred in poultry and wild birds in both Canada and the US, with spillover events in dairy cattle in the US as well. And this is as of July 2024. The virus has also spread to numerous other mammals, so it's even been documented in the far north in polar bears. So it's clear that animal-to-animal transmission is occurring for this current subtype of avian influenza. There's also been some transmission from animals to human, although this still remains rare. So in the US, 4 humans have acquired mild influenza infections from cows. So poultry and livestock workers, as well as other people in close contact with wildlife through work or other activities like harvesting, may be at a higher risk of acquiring infection. So in terms of the symptoms that you might experience if you do acquire avian influenza, these include fever, headache, muscle pain, runny nose, sore throat, feeling tired, cough, and irritated eyes. Most of these symptoms would occur within 10 days of exposure to infected birds or other mammals. There are ways or means that you can take to keep yourself safe. So we'll run through some preventative measures that apply to harvesters, and then some that may apply to the general public. So for harvesters, it's recommended that you do not handle or eat birds or mammals that appear to be sick or have died from unknown causes. Always work in a well-ventilated environment when you're working with wildlife or carcasses. Avoid direct contact with blood, feces, or other respiratory secretions. If possible, do not eat, drink, or smoke, and do not do other activities that may cause you to touch your face or your eyes while you're handling wildlife. If you can, wear nitrite or rubber gloves and wash your hands with soapy water after you remove those gloves. Oftentimes water is not available, and so an alternate that you could consider is hand sanitizer or wipes that contain at least 60% alcohol content. It's ideal to keep children and pets away from materials and areas that could be contaminated. After you're done, thoroughly cleaning and disinfecting tools and work surfaces, including those that may be in vehicles, with hot soapy water, and then using a household disinfectant, something such as 5 teaspoons of bleach and 2 liters of water to clean those surfaces. And then, of course, after working with wildlife or carcasses, immediately removing and washing clothing and footwear that may have been contaminated with blood, feces, or other respiratory secretions. For the general public, there are also measures that can be taken to keep yourself safe. So it'd be ideal to keep a distance from wild birds and other wild animals, and don't touch, feed, or handle them. Avoid contact with animals including livestock like cattle or goats that may be sick or infected. Always wash your hands after being in an area where birds and other wildlife are living or nesting, like parks or zoos. Children should be monitored to ensure proper hand washing as well. And then pets should be kept away from birds and wildlife and their feces, since we know animal-to-animal contact or spread is occurring, and pets can get sick as well. Thank you.